Nerve pain can be difficult to describe, and patient descriptions vary from burning to pins and needles, all the way to itching or the sensation of water running along the skin. The affected area can be sensitive to touch. The causes vary from trapped nerves due to scar tissue after surgery, a bulging disc in the spine, or damage from diabetes or medications. Because of this, nerve pains can be very difficult to treat, which can be frustrating, particularly as the painkillers that we think of as typical, like paracetamol and codeine, are less effective than for other types of pain. We sometimes try drugs that were designed for other medical problems that have now been found to help with nerve-type pain, such as drugs originally designed for epilepsy. These medications, like gabapentin and pregabalin, are strong painkillers, but do come with potentially significant side effects. These can include drowsiness, weight gain, constipation, and we must remember that all anti-epileptic medication can cause congenital malformations. Injections may be an option for some nerve-type pains, but long-term reliance on injections may not be beneficial for lifelong pain management. If your neuropathy or nerve pain is related to diabetes, the best thing you can do is to take every step possible to improve your diabetic control to prevent further worsening of the nerve damage. Sometimes the surgeons can help if the nerve is trapped by something like a bulging disc in the spine. There are advanced pain techniques, such as implanted electrodes within the spine, but this is something that can be discussed within your initial consultation.
Nerves in the body are important in maintaining muscle function and strength. If you have nerve pain or neuropathy in any part of your body, it is common for you to avoid using that area as much as possible. For example, you might walk in a different way to compensate for the weakness and inflexibility in that area. However, this can then lead to other problems like back pain. It's therefore important that we try to maintain strength and flexibility in the area of nerve pain to prevent these other issues from occurring. This can be difficult when the nerve pain has flared up, so we need to work together to devise a set of movements, stretches and exercises that you can do even when the pain is severe. On good days, you can do a little bit more, but always avoid a boom and bust cycle. Doing too much on your good days can put you in bed for 3 days afterwards, so a gradual approach to increasing movement is great. And remember, it's a marathon, not a sprint. You may have setbacks when the pain flares up, but by accepting these, you can still make overall progress over a period of time.
When we think of nerve pain, it's important to remember that the brain is intimately connected to nerves throughout the body, and it's impossible to separate problems with nerves from the way the brain interprets them. That's one of the reasons that nerve pain can flare up when you're feeling a little low or depressed. The brain finds it much more difficult to manage when it's stressed by mental health, poor sleep, loneliness or isolation. A psychologist will be able to look at the link between your nerve pain and your mental health, and often the first step is increasing your recognition of this and seeing the link in your own life. We can then work through together how to intervene with this to help, including when the pain flares up and the medications don't really help. You may have developed your own strategies for managing these flare-ups, whether it's meditation, distracting yourself with music or work, or quietly taking some deep breaths. A psychologist can help build on these tools that you have naturally developed. There may be some other strategies that you haven't thought of before. You may not relate to all of these, so exploring what works best for you is important. Your tools are like any skill. They improve with practice, so consistency of using them, even when you are not having a flare-up, can help you to use them effectively when you do need them.
I've had diabetes for 20 years now, and it hasn't been as well controlled as I would have liked. It's difficult to eat properly when you're busy. My doctors have tried lots of medication, but eventually I went on to insulin. I started to notice pins and needles in my feet at first, and was told that I was developing neuropathy because of poorly controlled diabetes. And then it spread to my knees and fingers too. The pins and needles I could cope with, but then I started to get burning pain, which was awful. I couldn't even bear to wear socks. I had to wear sandals all year round, and so would avoid going out with family and friends because of the pain, and I didn't want to spend all day moaning and ruin the day. I've tried lots of painkillers, but nothing fully takes the pain away. My doctor said I had to get my diabetes under control, so I had an insulin pump put in, which has made it a bit better. I find it easier to cope with the flare-ups of pain, but I still take painkillers like cocodamol. I tried nerve pains, but they made me too drowsy, so I stopped taking them. The psychologist showed me that social interaction can release good chemicals which help fight the pain. So I go out a bit more now and then, and I use meditation when I'm out and about to help me cope.